Good? Yeah. We start? Okay, we're gonna get started. So if I can please ask everyone to sit down.
Health systems around the world are becoming increasingly digitalized. Imagine a future where this young mother to be receives trusted health and nutrition information through an app that tracks all of her pregnancy milestones. The local clinic logs her vitals digitally so she doesn't need to carry her previous medical records around. This allows health workers who may not even be in the same location to track her pregnancy, diagnose any issues, and prescribe supplements or medication. Her data is also anonymized and collected by district, state, and national health systems. This feeds into provincial and national health planning and helps make better decisions about communities' health needs. Using real-time health data can lead to quicker response times from doctors, more accurate diagnoses, better targeted distribution of medicine and equipment, and more efficient and resilient health systems overall. It also allows researchers access to more and better information to develop new medicines and equipment. What's more than half the world now uses the internet. This allows health planners to reach nearly 5 billion people with better public health strategies using digital tools. Improving digital connectivity must remain a priority to ensure that these benefits apply to everyone and no one is left behind. While digital health and data offer huge opportunities, people are often not aware of who has access to their health data and how it's being used. Unless the collection and use of health data is regulated, there are risks that data could be used ineffectively or unethically rather than to improve health outcomes for the public. Data misuse has the potential to harm people and minimize health benefits for the population, especially for marginalized communities. So we need a system in place to protect us and ensure that our data is used for everyone's benefit. Better health data governance can protect us as individuals and protect us as a population. Health data governance is a set of rules that governments and other bodies must abide by in the collection, use, and disposal of health data. Unfortunately, at the moment, there is no globally agreed set of norms and standards that guide countries, technology companies, and other stakeholders on the use of our health data. Transform Health is calling for a global health data governance framework to maximize the public value of health data while protecting individual rights. A global framework would establish an agreement between nations around a set of common standards for the governance of health data. A global framework must be developed through a fully inclusive process and underpinned by the human rights and equity-based health data governance principles. A global set of health data governance principles were launched in April 2022 with the core objectives of protecting people, promoting health value, and prioritizing equity. They were developed through an inclusive and consultative process, bringing together expertise from over 200 contributors across geographies and sectors, and have already been endorsed by over 140 organizations and governments. Once developed, we ultimately want to see a global framework adopted and adapted by countries into national legislation to enable a world with more trust in health systems, stronger safeguards, and better health outcomes for you, me, and her. Transform Health is calling for action from the WHO and its member states to prioritize health data governance and a global framework. Over 140 organizations have signed a letter demanding that action be taken on this important agenda. Scan the QR code and join them today. Find more information at healthdataprinciples.org and transformhealthcoalition.org.
Honorable ministers, vice ministers, distinguished speakers, and participants, I have the pleasure of welcoming you to today's session towards a global health data governance framework. My name is Matilda Forsland, and I'm the Executive Director of Transform Health. We are a global coalition of more than 130 organizations committed to harnessing the potential of digital health and data to achieve universal health coverage by 2030. It's really a privilege to co-host this important event with the Ministries of Health of Cameroon, India, the Maldives, Philippines, and Sri Lanka, together with the support of our partners AHIN, Helena, and Verkinsa. We are honored to have with us here today Honorable Ahmed Nassim, Minister of Health of the Maldives, Honorable Manuda Malachi, Minister of Public Health of Cameroon, Honorable Nasser Ahmed Masroui, Minister of Health Zanzibar, Dr. Alexei Caillo, Vice Minister of Health of Costa Rica, and Dr. Samira Asma, Assistant Director General for Data Analytics and Delivery for Impact at the WHO, as well as other government representatives and stakeholders. Data is really a vital tool to improve health and well-being by strengthening health systems, responding to health emergencies, improved patient management, furthering research and innovation, and advancing universal health coverage and the SDG goals. The digitalization of health systems and the proliferation of digital technologies has significantly increased the amount of health and health-related data that is generated, collected, and used on an everyday basis. While this really offers a huge opportunity, it also raises significant questions and challenges around data privacy, ownership, sharing, and access. And this is underpinned by the foundational question about who governs our data, who makes decisions with that data, and how is that data used. There is really a pressing need to strengthen the governance of data, as we heard here in the video, to ensure that it's used for public benefit and prioritizes equity while also protecting individual rights. And that is why we're here today. We're here to discuss how stronger and more equitable health data, how we can ensure better and stronger health data governance, but also to build support to initiate the development of a global health data governance framework, where governments can align around a set of minimum common regulatory standards for endorsement at the next World Health Assembly. So we will begin today's session with some keynote remarks from our honorable ministers, vice ministers of health, that we have here today. But first, I would like to introduce Dr. Samira Asma to deliver her remarks on behalf of the WHO.
Good afternoon, honorable ministers, excellencies, distinguished representatives from member states and partner organizations, colleagues, and dear friends. Dr. Tedros was supposed to be here, so I'm sure I disappointed you by being here, but he sends his very warm greetings and his gratitude to Transform Health for hosting this and for the supporting organizations as well as the co-hosting member states to discuss a very important topic that is based on trust. And that has been a challenge that we have seen during the COVID-19 pandemic. And data governance, not only data governance, but good data governance that is built on trust is going to be crucial in translating the lessons that the COVID pandemic has taught us in a very hard way. So the time is now to recognize the importance of timely, reliable, actionable, and accessible data and operationalize it that also makes data a global public good, because we need a global sharing of data and health information systems, but at the same time, protecting the basic human rights in terms of personal data privacy is very important. Without this, it will be very difficult to precisely identify where, when, and how an outbreak occurs, and also identify what is ailing countries and our populations. This week, we launched the World Health Statistics Report that tracks 59 health-related indicators. And also this week, WHO is launching the World Health Data Hub, a go-to place for all health data, which is based on the foundation of good data governance. Last year, or a year ago, maybe in 2022, WHO held a global governance summit where we looked at the data that is available and the type of data that should be shared during emergencies and during peacetime. There are different qualifications of those data that can be shared, as well as data that is accessed and should be made available because of various research development programs. And underpinning the sharing is the digital architecture. So a good governance mechanism for both data and digital solutions is extremely important. And as you said, time is now for us to operationalize the good data governance practices and develop a common framework. And we look forward to partnering with you in developing this practice built on a lot of successes and work that has been done by WHO, our member state organizations and partners. So we don't start all over from scratch, but build on the momentum. And it is also fascinating to see many member states that have already made leapfrogging efforts. For example, in Maldives, the blueprint on data and digital infrastructure, or when we look at India and the digital transformation that is happening, or in Sri Lanka. So there are many very good examples. So we really don't need to build everything from the start. We really need to bring together all the best practices and scale it as soon as possible and have a real common understanding. So data truly is a global public good and is used to improve policies and programs and ultimately improve the health of the populations we serve. Under Dr. Tedros's leadership, when he took office, his commitment was to make WHO, which is a member state-driven organization, to serve member states and to make this organization a really modern, data-driven organization. And we can't do this without a good governance foundation. So we look forward to collaborating with you, as Dr. Tedros says, embracing the partnerships and the ideas and creativity and development. So look forward to and wishing a very constructive dialogue. So Your Excellencies, thank you so very much for your support to this initiative and to WHO. Thank you.
Thank you. Bismillahirrahmanirrahim. Assalamu alaikum. Greetings from the Maldives. Honorable Manauda Malachi, Minister of Public Health, Cameroon. Am I pronouncing the name right? Honorable Nasser Ahmad Mazrui, Minister of Health, Zanzibar. Dr. Alexi Carrillo Villages, Vice Minister of Health, Costa Rica. Dr. Samira Asma, Assistant Director General for Data, Analytics and Delivery for Impact WHO, Transform Health Coalition, Asia eHealth Information Network, and other regional digital health networks, delegates, colleagues, and friends from around the world, I wish you a very good evening. Data is crucial to strengthen the health sector. Through informed decision-making and formulation of evidence-based health policies, data plays an important role in enhancing the health and well-being of population by enabling us to work towards improvement of health services. The importance of data was further highlighted during the COVID-19 pandemic, during which timely data was utilized in countries, including Maldives, to assess and manage the pandemic. With the increased efforts to digitalize the health system and establish integrated health information systems, accessibility to data has significantly improved. Digitalization of the health sector is a priority of the government of Maldives. In line with this, we have moved towards the use of digital platforms such as district health information software for the collection and reporting of routine health information. Moreover, the Ministry of Health is currently working towards the establishment of a well-integrated, interoperable health information system to further strengthen the management of health data and improve health services. Delegates and colleagues, the advancement in technology and increased data accessibility is accompanied by risks such as the potential for data misuse and violation of individual rights. Thus, there is an urgent need to strengthen health data governance due to the sensitive nature of health data. Special laws and security measures are required to ensure data confidentiality and prevent people or communities from being harmed. In addition, data management practices need to be evaluated and assessed to identify potential harmful effects and resolve these issues. We must ensure the use of data to strengthen the efficiency and resilience of the health system by providing accessible and equitable health services. It is also vital to ensure that data we collect represents all individuals, including marginalized and vulnerable populations, so that no one is left behind. To strengthen data governance, it is important to align the use and management of data with the existing health data governance principles, which you had seen in the video from Transform Health. Furthermore, a collaborative effort between countries is required to build a framework based on these principles. This would aid in the development of standards and guidelines for the management of health data and sharing of such data at the national and global level. As a result, currently established health data system would be strengthened and data security would be improved. This will ultimately lead to building public trust in the health data system and support provisions of value-added services in our countries. Effective health data management will enable the utilization of data to improve the well-being of the population and progress towards achieving universal health coverage. Delegates and colleagues, Maldives is pleased to be a part of the efforts to enhance health data governance. We also acknowledge the importance of developing and adopting the global health data governance framework. We would like to work together with other countries and provide any support necessary to implement the framework. I would like to thank Transform Health for organizing this event and giving Maldives the opportunity to contribute. Thank you very much and have a good evening. Thank you.
And now I would like to invite Honorable Minister Manuda Malachi, Minister of Public Health of Cameroon. And I think we have a representative for him here today. Thank you.
Honorable Ministers of Public Health, distinguished delegates, dear participants, as you can see, I'm not the Minister of Public Health. Thank you. I will deliver the keynote of Cameroon on the behalf of my minister who is not here. So, the Ministry of Public Health of Cameroon endorses the health data governance principle, which brings a human rights and equity perspective to the use of data within and across health system. It recognizes the need for a global health data governance framework underpinned by equity and right-based principles to maximize the public benefits of health data while preserving individuals' rights, and encourage governments and WHO to develop such a framework. A global health data governance framework can strengthen national approaches to health data governance. As health system and other aspects of our lives have become increasingly digital, the volumes of health and health-related data continue to grow. As the world recovers from the COVID-19 pandemic, health data has become a critical tool for strengthening health systems and addressing future health challenges. However, the rules governing data collection and use have not kept pace with the growing potential of data to improve health and well-being, or the potential harm resulting from data misuse. To harness the potential and manage the risk of sharing health data within and across borders, countries must work together to develop a set of common regulatory standards for health data governance. Such standards articulate within a global health data governance framework will bring countries together around a common vision for the collection and use of health data maximized that maximizes public benefits while preserving individual rights, and will help strengthen national legislation and govern the exchange of health data between countries. Cameroon Ministry of Public Health has endorsed the principles of health data governance, which are a set of 8 principal roots in equity and human rights to underpin the development of a global framework for health data governance. The principles aim to support sustainable and resilient public health system capable of achieving universal health coverage. The principle creates a common vision where all people and communities can share, use, and benefit from health data. The principles are built around 3 interconnected goals: protecting peoples, promoting the value of health, prioritizing equity. These values resonate with Cameroon's Ministry of Public Health as it pursues digital transformation of its health systems. The health data governance principles will inform Cameroon's work in developing its digital health and health data policies, keeping the interests of individuals and community at the forefront. Thus, the vision of the Digital Health System Strategic Plan 2020-2024 is that by 2024, digital health will effectively contribute to universal health coverage through informed decision-making and all levels of the health pyramid, through reliable, robust, secure, and interoperable systems. The health data governance principle are essential steps towards the development of a global framework for health data governance. Cameroon encouraged the WHO and other governments to champion this agenda and support the development of a global health data governance framework. Thank you for your attention.
Thank you so much, representative from Cameroon. I would like to now invite Honorable Nasser Ahmed Masroui. I actually knew how to pronounce his name earlier. I used to live in Tanzania for 5 years, so I do normally. Minister of Health Zanzibar to take the podium. Thank you.
Honorable ministers, distinguished guests, ladies and gentlemen, good evening. It is my great honor to be here today with you, representing my Ministry of Health from Zanzibar. I'm very delighted to be part of this panel, and I will share the experience of digital health in Zanzibar, where we have been and what we are doing and what we are looking for in the future. For the past few years, Zanzibar has been reforming its health systems to take advantage of the huge potential of digital technology. We developed fast health strategy in 2020 for 5 years, from 2020 to 2025, with the vision of improving the provision of safer, equitable, accessible, efficient, and effective health services at all levels of health, from community health to dispensaries, health centers, district hospitals, regionals, to referrals. Among the core objectives of the strategy is the facilitation of effective data use for evidence-based action. To support this objective, the strategy emphasized the need for better data governance, to improve data quality, data protection, data sharing, and data use for informed decision-making across the health sector. Guided by this strategy, the Zanzibar Ministry of Health, in collaboration with DANIDA, developed the first Zanzibar Health Data Governance Framework last year. Governance framework was very, very important because we don't want to create graveyard of data. Data were collected from many sources, but they must be integrated, they must be used properly, managed properly, with privacy. We are very happy to have the first step. First of all, we managed to make strategy and then framework. And now we want to start to work with our framework. We're ready to take this step, but we recognize that a second, much larger step lies ahead of us. Policies and frameworks document provide us with a starting point only. But we must turn those policies and guidelines and framework into practice, was ensuring that we respect everyone's rights to privacy and agency over their data, which have been collected. And so, with the support of D3, we are now working to operationalize our health data governance framework together. And we are taking actions to improve our data security, and data sharing processes. And we're taking actions to build the capacity of our staff so that they'll be able to use the data effectively and responsibly. We also need to acknowledge that there's a very diverse range of stakeholders within the health data ecosystem, including patients and communities that we collect data from them. We have in Zanzibar CHVs who are collecting data from the communities, individuals, and all these data, they're collected. And we make use of this data to make decisions and interventions. We know that there's a lot of capacity that needs to be developed within our team and that we cannot do this alone. Therefore, we need to continue working with partners like Ministries and anyone else. We're looking for alliance on this, who are providing us with the evidence, with the advice, training, and resources that are enabling us to progress in this arena. We're also looking to learn from our counterparts in other countries as well. I'm happy today to see my friends from Maldives here. He was in Zanzibar, I think 20 years back. 20 back, he was Zanzibar. He knows Zanzibar very well. I think he's come there in 1997, something like that. And he stayed in Zanzibar for a whole month. So when I'm talking about Zanzibar, Maldives, they know. And we're ready to learn from any country. Their achievements, we can come and learn, and I think by doing so, we'll improve our ability to work in digital health. So we believe that once we have operationalized the policies and guidelines that we have created here, this will set up to use data to generate huge improvements in the efficiency and quality of health services that we provide to our citizens. We are very much looking forward to work with partners and friends so that we can have data which can be used routinely for monitoring, evaluation, and planning at all levels of the health system. When we have the clean data, safe data, we politicians, we can make good decisions, right decisions, timely decisions. So always these data are very important for us. I hope that after saying this, I've highlighted to you the importance of data governance. Data governance is very, very important. And that's what in Zanzibar we lack. And that's why our partners are with us to keep this data governance in order. And by doing so, definitely, Zanzibar health structure, Zanzibar health services will change. And we are looking for that change. The goal of using health data impactfully, sustainably, and safely to improve the health and well-being of our population in Zanzibar. After saying so, I welcome you all to Zanzibar. Safe place. Do come and enjoy. Zanzibar is a friendly place, and we're looking forward to see you soon. Welcome to Zanzibar. Asanteni sana. Thank you very much. Thank you very much for listening. Asante sana.
Thank you very much, Honorable Minister. Now I would like to invite Dr. Alexei Carrillo, Vice Minister of Health, Costa Rica.
Good evening, everybody. First of all, greetings and thank you for the invitation to Maldives. I'm from Costa Rica, and I want to see you soon in Costa Rica also. Pura vida, like we say that. I'm really sorry because I don't have any speech. I don't know I have it. But first of all, thank you for this moment. Thank you because I'm really happy to be in here. I can't imagine a room completely odd people out of their head. That's saying in Costa Rica. In Costa Rica, don't believe in data health, in health in data, and doesn't believe in digital health 5 years ago. Right now, we have another reality, and we are really happy to do all the things that we do right now. The transformation, and trust me, I really love the name Transform Health. Transform is not just digitalization right now, okay? First of all, we have to transform our mind, okay? When you transform the mind, maybe you transform the way you do the things. So here are a lot of people who think different, like Steve Jobs said, okay? And right now, we are going to start the discussion about all the possibilities in the whole world. We are people of any kind of world. We are trying the same objective. So I just want to say I'm really happy to be here. Say thank you to Recainsa, thank you to all the organization, and really warm hug to all the honorable ministers here. Thank you very much.
Okay, so thank you so much for those very special remarks, and thank you for your endorsement to also push forward with a global framework. We've had very strong commitment here to strengthen health data governance. And I want to say thank you, but also to invite, if we have any questions from the audience here today, to ask our honorable ministers anything or follow up on any of the statements that they made. Do we have some microphones? You can put up your hand if you have a question, maybe.
Thank you. Thank you. My name is Kokra Lusna Aswa from Integrate Health, a US-based organization with offices in West Africa. I'm the Senior Director for Monitoring, Evaluation, and Quality Improvement. I have just one simple question. Can you tell us your experience in using, maybe without knowing, unconsciously, bad data that lead to bad decisions in the past? Did you have such experience in the past?
Do we have anyone that wants to take that question? We can. Okay. Minister of Health, Zanzibar.
So maybe I may repeat the question.
Oh,
Or it was clear?
I think we got it. Yeah,
Okay.
thank you.
You know, in Zanzibar we have CHVs, community health workers or volunteers, who are collecting data from different districts. In our ministry, we thought that we can have one size for all. One size for all, then our intervention to this district is the same. But for a long time, we've been using that. But we find still we have mortality is higher. Why? But because we didn't have the data, or we didn't use the data. The data which has been collected by the community health workers who are not educated much, but they have the app, they're collecting data and they're putting that, and the data should be read correctly and should be used correctly. So we've been using same treatment all over the country. But after going deeply on data, we said, why still we don't have improvement? We found that in those data, it showed that in urban area, pregnant women are suffering from hepatitis. And in rural areas, they're suffering from anemia. So we should use different intervention, not the same size for all. Data which has indicated us this is the way how now we use different interventions, and now we're seeing that things are improving from time to time. That's the decision which we made after correction. Thank you very much.
Thank you. I think we have one more question, and I think then we need to go to the panel.
Good evening, everyone. It's an honor for me to be here today. I'm Chiamo Seraphine from People's Health Movement, Cameroon. So I wish to ask that, because I think it's very important for us to move from generalities to specificities, because when we talk about data, it is very important because it maps out the context specificity so that we can direct responses that are appropriate to solve the problems. So I just wish to ask that what are some of those specific areas that are big, because when we talk about data, we are talking about funding, because data doesn't just come like that. We need to fund for it to come. So which are some of those strategic areas that the government is putting up policies or the finances so that we can get appropriate data from that perspective? And I think one of the most pertinent and difficult section to get data from is from social determinants of health. So how is that being targeted? Is that being funded? Or which are those specific areas that the government is directing fund in order to get the data that we want to direct our policies towards? Thank you.
Thank you. Do we have anyone else?
Can she make straightforward question?
Yeah, okay. I think it's around how do we fund fund data, yeah. Yeah, and especially around social determinants of health.
I think Costa Rica
Yes. Okay, that's a difficult question. Okay, first of all, is that change to the mindset. That's the first of all. When you understand the value of the data, you don't care what is the price of the clothing, okay? In Costa Rica, we have a lot of challenge about the foundation, about the practice of the right data storage. So what we do a really strong politics about the data, about the governance, and then we start step by step. Who first? Okay, the public health. And then we enter to the private sector, and then we enter to the regional sector. It takes between 3 and 2 years, not 2 and 3 years. And how much? Right now, I don't know. But trust me, when the people knows it's important, the people do it.
Thank you so much. I think I would just want to pose one last final question from me. So my question is, how can we build on the momentum here today to initiate the development of a health data governance framework that could be endorsed by member states next year at the World Health Assembly? Yeah. Yeah, this one.
We just conducted a program in one of the atolls, in Faf Atoll, and we took stock of all the people in that entire atoll, and that was very useful information. And we are hoping to duplicate this in the entire country, because when you are in a pandemic, situation or some serious issue like that, then what you need is the data that you have in order to treat the people and be cautious and be careful in the treatments. And this is very important because we may be actually not giving the right right treatment to the people because they have other communities which we have to address and use this information. And we have here with us a staff who did this work in FAF et al. I would like you to explain a little bit on this, the type of work that was done. I think it will be very useful.
Yeah.
Thank you. Just to brief a little bit on what we have been doing in FAF et al. So the project is based on trying to revitalize primary healthcare in Maldives, something which we really did back in the 80s, where people actually, the health facility staff, the community health workers, they went to the households levels. They really had a very good connection with every single family that lived in the community. So since we moved more to the curative care, this process where we used to go and have this routine process where we really engage with the community is a little bit weaker nowadays. So the program that we are doing in FAF et al., the focus is Maldives is nowadays going through a lot of issues with regards to non-communicable diseases. Most of our deaths are happening because of that. So one thing we really want to do is focus this program on trying to figure out a way that we can bring down our burden when it comes to NCDs. Hence, one initiative we are doing is that we are doing what we call as a population-based screening for every single Maldivian aged 18 years and above, regardless of their current status. So the program will screen everyone and set baseline risk. And when we are collecting information, we are also collecting their education level. So that can be something related with social determinants because education can have an effect on non-communicable disease as well. Mm-hmm. And there are other parameters that we are measuring as well. And one interesting factor that we notice is that even with the information we have nowadays is that people know that they have the disease and they do take the treatment, but the compliance or the effect that they have on controlling their disease outcome is weak. So this may actually indicate something is not happening the way that it should happen. So it's sort of like giving us a mechanism to intervene and see what is going wrong. They are saying they are taking medication, they already know they are diagnosed, but why are their hypertension level or diabetic level not controlled? So something is happening. Something is there. Maybe awareness is weaker or people's adherence is weaker. Something is happening, so that is our focus now with the information we have.
Thank you.
Thank you.
All right, I would like to say thank you to our honorable ministers for their strong commitment to this agenda and for your keynote remarks here today to really show, a lot of commitments around a health data governance framework. I would now like to invite you to actually sign a pledge that we have and also to take a photo to memorize this. So if I can please invite you in front here to sign and then to take a photo. We've got a pen. All right, and now we're going to move into the next section. So I'm going to introduce Rebecca Disler. She is the strategist for AI, data, and digital health at the McGovern Foundation, and she will moderate the next session. Thank you.
Good evening, everyone. How are we doing? Yeah, how are we doing? There we go, there we go. Thank you, Mathilde, for the kind invitation to join today's session, and to the honorable ministers for your excellent remarks and for sharing those critical perspectives. It's a true honor to share space and this conversation with you. So I'm looking around the room, and I see some new faces and some familiar faces, and I just want us all to take a moment to reflect here. In every conversation that you have been in this week, on the sidelines or perhaps at the World Health Assembly, whether it is mental health or climate change or cervical cancer or supporting frontline health workers, every conversation that you have been a part of outside of this room, data is the lifeblood of that issue area, whether or not it's mentioned, I should say, in those conversations. It is at the foundation of every product, of every program, of every objective that we are seeking to collectively drive forward this week. I'm always struck by this statistic. An astonishing 30% of the world's data is generated by the healthcare industry. 30% of all of the world's data is generated by healthcare. And so us at the Patrick J. McGovern Foundation, we're an organization that's focused on advancing artificial intelligence for the public benefit. And we see tremendous potential, as our partners do, in the ability of AI to leverage this data and to transform health systems around the globe. But there is a very real tension between that tremendous potential and the very real challenges that Mathilde and the honorable ministers have shared in their remarks. And it's a tension that underscores the importance of a rights-based, equitable governance framework to ensure appropriate and ethical use of that data, whether it's for research or care delivery or AI-enabled innovations. So our panel discussion today will specifically address the need for that kind of global framework. And what I will do first is invite Kirsten Matheson, the policy lead of Transform Health, to come up and share a little bit about where we are on that global data governance work. And then I will come up and introduce our panelists one by one and ask them to join me on stage. So thank you, and more soon.
Thank you, Rebecca, and thank you everyone here, our honorable ministers, vice ministers, and distinguished guests. So as we've clearly heard from the introduction of this event and the remarks from our ministers and vice ministers and guests, that there's a clear need for stronger and more equitable governance of health data and for a global health data governance framework to really ensure that we are fully utilizing the potential of that data for improved health outcomes, while also managing the risks and ensuring that people's data is protected from misuse. This is critical to achieving our UHC and SDG goals and to really building trust in health data systems, which is critical to foster the use of that data for public benefit. So there's a growing consensus, what we've heard today, but also in the last years, around the need to really strengthen the governance of health data and data more broadly, with a lot of recognition of the need to strengthen particularly the regulatory environment. For example, this is emphasized in the outcome statement of the WHO Health Data Governance Summit from 2021, in the report of the Lancet FT Commission on Governing Health Futures, in the Global Digital Health Strategy, the Broadband Commission's report on virtual health and care, the Africa CDC Digital Transformation Strategy, recent discussions of the G20, and most recently during the event organized last week by the Health Data Collaborative on health information systems and health data governance, which really recognize the need for a stronger health data governance and a regulatory framework. But also, really importantly, there's growing need and recognition and demand from communities and stakeholders for action on this agenda. We've heard from young people, from the private sector, from parliamentarians, and from governments like here today. And with more than 150 organizations have signed on to a call to action letter calling for action on this issue and to really make sure we're progressing to ensure that we are better protecting and using health data through stronger regulation. So we encourage governments to respond to this, as we've already heard from a number of governments today, and we hope to hear through the next panel, to really work together to develop a global health data governance framework, to build that country consensus and alignment around a set of common regulatory standards for the governance of health data, which would in turn help support national governments in developing and strengthening their national legislation while really strengthening the governance of health data across borders. We encourage governments to prioritize and champion the development of a framework over the next year for endorsement at next year's World Health Assembly in 2024. But for this to happen, the action and the work needs to start now if we want to build towards next year's World Health Assembly. So we really encourage governments and the WHO and other stakeholders to work together to make sure we chart the pathway towards that goal of next year's World Health Assembly. We also really encourage everyone to ensure that this is done. While governments need to be in the lead, working together with WHO and partners, it needs to be also developed through an inclusive, multi-stakeholder process to really ensure that we're including the perspectives and expertise and views of different stakeholders, including civil society, in the process. And it's really important as well that such a framework, as Rebecca said, is underpinned by equity and rights, such as the equity and rights-based health data governance principles that were launched in April 2022, which were in the intro video of this session, and have already been endorsed by actually now 150 organizations and governments, with the most recent endorsements that we welcome from the Ministries of Health of Sri Lanka and Cameroon. But we must really build on the growing momentum that we've seen on this agenda to make sure that we do, from this day, don't sit on this, but we really drive that forward as we work towards next year. So building on what we've heard from our honorable ministers, we'll now hand back over to Rebecca to take us into the next panel discussion.
All right. Excellent. Well, we're going to keep that applause going and move, as Kirsten said, right into this discussion. So I am so pleased to welcome to the stage, and please, my friends, come up as I introduce you. So we have Dr. Anil Sam, Director of International Health, the Ministry of Health, Sri Lanka. Please come and join us. Oh, there we go. We have Dr. May Velasco, Director of the Philippines Department of Health Knowledge Management and Information Technology Service. We have Dr. Saif Shekelaji, Permanent Secretary, Ministry of Health, Tanzania. Apology, sir. We have Pek Sitaj, the Chief of the Digital Transformation Office, Ministry of Health, Indonesia. And last, but certainly not least, we have Jean-Philbert Nisengimana, Chief Digital Advisor to Africa CDC. So now, colleagues, just to give you a lay of the land, there's so much that we could cover in this conversation, and I'm mindful of time. So what we'll do today is I have two questions. I will start by asking one, and we will go down sort of this way in that response. And then I have a bonus round that we'll kind of call it a lightning round. We'll do it quick, and that'll be a third. And my hope is that reserves us some time for questions from the audience. So to begin, we have an extraordinary set of country perspectives, expertise, and experience on this panel. And so my starting question is, speaking from that work and your country experiences, why do you think we need that stronger and more equitable health data governance? And what is the regulatory frameworks that you see are required? And if you can, what are the risks if this isn't addressed? So, Dr. Anil, we'll start with you.
Yeah, thank you very much, all the dignitaries, and it is such a amazing experience, I must say. And if you come back to the question about I start with a good example of, now we issued the digital vaccine card in Sri Lanka, but that was health data, but we had to share. We had to share to get visa, you know. So so the data governance as data sharing, so that is one, I took that example. So these traveling, it is important for the individual who get the vaccine card so that we had to share with that data with whatever the High Commissioner or embassy they want to share to get their visa. So like that, sometimes we had to share with the non-health entities as well. So that's that. So like that, even and health insurances and things like that. So that's it's not a very simple thing. That's why governance are not simple. As our political dignitaries are here, they know very well governance is such a difficult thing. So data governance, though it is a one word, it has many complexities. So that is why we should have regulations, international regulations accepted by at least majority of our partners. That is one way. And in the same manner, I hope some representatives from Estonia are here, because recently our digital health team visited Estonia. We consider, we can consider it as a role model, because they are, even the way they started with sharing their health systems, so they, after some time, they shared that data with the insurances, and that's again important for the client. So in that manner, so that's a very, with many stakeholders, though we call it health data, to become useful for the client, to the individual. So I think we have to think about at different levels of sharing as well. That is my perspective in this regard. Thank you.
Thank you so much. Dr. May, over to you.
Can you hear me? Right. All right. So I think the reference document actually highlights a lot of issues for which we could all use as reasons, actually, in pursuing a health data governance framework. But I think the Philippine experience, and I think other countries would have experienced similarly, at the onset of the pandemic, data was actually hard to come by, surprisingly. So we have and just within the Ministry of Health, over 60 information systems, including surveillance systems and other informations that actually collect data on health system capacity. And yet, with those information systems, we are actually unable to get not just data, but information that we needed for a better response. So that's a very shocking reality to be confronted with, and a reality in which you actually had to respond quickly to control the pandemic. So I think there have been a lot of realizations throughout that. I think one of which is the value of good data and information that can actually be used to inform decision-making at all levels of the health system. And I can speak more specifically to the national level. Within the ministry, there was this incredible demand for data, for good data. And that demand has not waned at all. In fact, that demand has increased, and I anticipate will increase in the coming years. And I think that is a good thing. Our distinct challenge within our office is actually how do we meet that demand, you know? So I think one of the, so apart from that, we also came to the realization that apart from we need data, but we did realize that good information can help us determine a better response. And that's a major learning lesson for the Philippines, because if that is what good data can do for response, there is absolutely no reason that it cannot be done for the rest of other health system concerns, rather. So I think that's a major reason for rationale for why we would support the development of a health data governance framework. And ultimately, and establish data rights and ownership, certain legal instruments that actually contribute toward encouraging, or rather ensuring data security, and lastly, even facilitating innovation using health data. I still think there is a lot of room for improvement for instituting additional protections for people, for individuals and communities. But I think the regulatory framework that is most needed in the Philippines is that which promotes data sharing and interoperability. So we collect mostly publicly funded information, and in the Philippines, roughly half of the health sector is private. So we just have no idea of what is happening in the private sector. So additional regulatory frameworks that would improve access to data within the private sector, which is currently limited and mostly submitted as part of health facility licensing requirements, I think would be the most needed at this point for the Philippines.
Absolutely, thank you. Dr. Shakiklagji, apologies.
Thank you very much. You can just call me Dr. Saif. I think the last
Dr.
one
Saif,
is difficult
my
for you.
apologies, Dr. Saif.
Okay.
Thank you.
Thank you very much. Good evening. Responding to your question, I'll start to talk the experience and then why digital health governance is very important. Currently in our country, and maybe not only in our country, in other countries also, we have different systems for data collection in the different, all levels of the healthcare system. Because you do have many companies selling their systems, and then these health facilities they buy, and then they collect the information. So what is missing there, you don't have the business process. Everybody collects its own information. So this is one of the big problems, and as the ministers have said, so you do not have the data which is standardized if you want to make the decision. So that's one. But secondly, having all these data being collected in different systems, they are not integrated. They don't talk to each other. You have a different surveillance collecting this information, that information, but they are not integrated in such a way you can pull all this data and then you can use that data. So if you do have the digital health governance that assure you the better system that you are collecting the data, what kind of data is being collected, and also safeguarding the system. And in fact, the governance is that the commitment that the country or the government is making in the way the data that is going to be collected. Coming to the framework that we have in our country we do have a national digital health strategy that is already in place. And in this, the governance framework is already included. And what it assures is it assures two main things. One, it assures how the data now flows from all levels of health facilities, starting from the private even to the public. So it answers the first question and the problem that we are having. But the second, it is standardized, how the data should be collected, how the data should be accessed, and how the data should be used. Thank you very much.
Thank you. Excellent. Sutaj, over to you.
Okay. Okay, thank you. First of all, I would like to thank you for having me today. Yeah, I think this is a very important topic, yeah, discussing about data, especially for data governance. Yeah, most of country now looking forward to trying to find the best effort how to digitizing the health services. Yeah, to not only to collect the data, and also to give the accessibility the data to the patient or to the peoples. Yeah, more increasing to collect the data, not only to give the benefit for the countries, yeah, to promote the value of the data, but also to increasing the risk. Yeah, we consider about the data breach, data thief, and also accessibility from the not right people to access the data is considered to govern, yeah, the data, the data security itself. Not only talking about how we can interrupt every different system using the same standard, but also how we can protect the data. Because when the data can accessed by other peoples not eligible to access the data, so we cannot protect the data privacy for the patient, and it can use to criminalization and also for discrimination and many things. Because of that, it's very important thing how we can robust data governance, especially the framework to build in the system, and also to implement this data framework, especially the data governance framework, to make sure we can get the benefit for the data, but we can still manage the risk from the thief and also from others negative ways to access their data. Thank you.
Excellent. Thank you.
The question was complex. It had many, it had many components. I'll talk about two: the why and the risk. And I think on the why, my colleagues and the honorable ministers really talked about the why. For me, the way I can summarize it is to realize the value of data. There is no question that health data has tremendous value, but we need a framework for a governance so that that value is realized. And as I continue to hear what my colleagues were saying, we have really expounded on the value of data from the perspective of the government or the public health officials. But we know that there are other perspectives that are equally important. The perspective of providers, the doctors, the nurses, those who own clinics or those who perform services in public institutions. They want the data to improve the quality of the service that they give. But that's not even what I really want to talk about, because the most neglected perspective is the individual perspective, the value of health data from the personal perspective. Because the way we drive health outcomes is by improving decision-making, collective decision, but most importantly, I think, individual decisions that people do make on daily basis in their lives. We've seen how in our continent, in Africa, when mobile financial services came in, the entire access to finance was expanded quickly. And we're looking at the same population. So very young people, digital natives. Now we are imagining what could happen if you could let these young people have their health data into their hands and then use that data to improve the decisions they make about their own health. I think a revolution in health equity awaits. And for us to get there fast, we can do it organically, but if we have a global data governance framework that affirms the principle that individual health data belongs to the people, the value of the data belongs to the people who generate this information, I think that can help us move faster.
Absolutely. Thank you. We'll move on to the second question in a moment, but I just want to take a moment to remark that what you've shared, just even in these opening reflections, we're getting into the use cases at the national level. How do we empower individuals with their own data? How do we make decisions about immunization and travel? How do we make informed or use data for better decision making, not just for emergencies, but in routine surveillance and routine systems? And what I want to do now, and I feel I will actually kind of kick it back to you, and we're going to come back this way. But what I'd love to do now is to take those perspectives that you've built from that national perspective and bring this up and have this conversation at a global level, right? We're here talking today about the potential of this global framework. So there's the work that you are doing in country to implement frameworks and regulation. And then we take a step back and we look at the global level. And so I'd love to hear your perspectives on how a global framework could support you in this work that you've shared with us, but also help to build alignment across countries as they also look to strengthen health data governance and regulation. So Phil, quickly to you, and then we will move back this way.
So global framework provided a template. And then countries can use the template to quickly put in place their national governance frameworks that are aligned. because we know that health data allow us to respond to not just national health risks, but global health risks. So for us to respond together on global health threats as a globe, we need to use data on a global basis. If you leave countries to do their own thing, and we've heard from the honorable ministers and other leaders here that countries have actually moved and put national data governance frameworks in place in their own country. If there is no global framework, the question of cross-border data flows, data sharing across borders will remain hanging or will be addressed in a very uneven way. And when that happens, actually the strongest, it becomes like the jungle. The strongest will get what they want, and the weakest will be sort of victims. And we saw that during COVID. If you have a huge market like India, you can develop one credential type like DIVOC, and then you solve the problem for your people, and that's very good. But imagine 55 countries in Africa trying to do the same thing, having to solve the same problems, spending money, and so on and so forth. It's very costly. So for me, I realize that a global data governance framework will help us a lot on saving on the cost of developing data governance and solve for the need for cross-border use cases like travel, continuity of care, and so on and so forth. Thank you.
Thank you.
Yeah, okay. Continuing the explanation from the you said before, yeah, about we can learn from the COVID-19. We have some issue here when the cross-border from the people to move other country to next country. The issue is about to acknowledge this is your certificate or vaccine is right or not. Yeah. And we lack because the WHO already built the standards about the QR. So we adopt this in G20 to build what we call the universal verifier code. So this is standard can use for all the country to same standard. So they can so we can use the standards along the country using this same standard for the QR universal for all the countries. And now adopted by Europe and also others country in the world. Yeah. Now more than 100 countries already adopt the WHO standard. So with this lesson learned, so we can also adopt the data governance framework, not only in terms of we need the standard, so rather than we debate every country, so better we can use this standard for all along the countries. And for this initiation, we need also to put not only in our regulation, better in the act, to put this, because it's very important thing to not only the government, but also other parties like private sectors to same standard using this data governance. Because when we need to collect the data, not only coming from the government, but also from the private sectors. Because of that, it's very important thing to same standard. We have data exchange standard using the FHIR, but we need more than that for the framework to secure the data and how to get the data for value set and etc.
Yeah, thank you.
I think I agree with you, but saying that there has to be a global framework that will be made and then people will start using. I'll advise that since this is a global and we are having different conditions in the world, what is happening in the United States is different what is happening in other developing countries. So the information that you want to get from the developed country may not be necessarily the same from other Western countries. So that approach is better, but if it's going to be used as an advice, probably you need to do consultative, asking people from the bottom what information they can give you by you when you are preparing that global, or else you have to ask the people, then they can give what they have, and then later on, the global will make one standard by using what they have received from other parts. But starting from the top, taking it down, I think I doubt it may take a very long process, because I think some of the information that you expect, for example, in our country, someone coming with fever, you really have to ask a lot of things to exclude the reason for the fever. But I think if you get someone from UK or from here, fever, they may consider only one thing. I think the message is reached home. It's just an advice, it's a good idea, but how we are going to make it, it may become simple if you start getting the information, how they think that global framework should be, and then from the top they can think, and then they can bring, it's easy. Rather than you just prepare one and then you send it to the lower, it may have some of the issues that I have said. Thank you.
Thank you.
Right, I agree with some of the points of my colleagues here, but I think I just would like to add that a global health data governance framework would actually reinforce and legitimize our own country-level priorities. I think that's one. I can safely say that I think even at different levels of the health system and amongst different individuals, including patients, service providers, local health system managers, and even people working at the national level, they have all encountered an issue related to data governance. So just seeing a broader picture of how these principles actually address an assortment of data governance issues is really important. And at least for our use at national level, very important for instance, with legislators to understand that these actually require investment. So a very practical use for it is actually securing additional appropriations for additional investment. So that is one. And I think in relation to how, well, I don't necessarily think it's alignment necessarily that we need to have across countries, but obviously at the global level and even at regional levels, data sharing I think would be topmost concern. Absolutely. But a lot of that is founded on trust. And if we are all on the same page and agree that these are the data governance principles by which we will operate, that means we can confidently share data that ensures the privacy of our citizens, but that the data that is actually provided is data that can be used at the regional, hopefully to better inform regional response and action, and likewise for global response and action.
Thank you.
Yeah. Actually, three things comes into my mind. One thing is medical ethics. You know, medical ethics usually don't change from country to country. So that is one kind of extreme. Other one is we have a practical IHR, International Health Regulations. So that is also a part of it. And other extreme, the individual discretion. I think our framework should fluctuate. It cannot be a fixed thing, I think. Time to time, depend on the like say possible pandemics and so on. We may have to, modify time to time, but to have frameworks between the three things I mentioned, the medical ethics, individual discretion, and one good example is IHR. IHR also we modify time to time. So I think the requirement for the framework is, I think we all agree, so it will be not a fixed thing. I think from the beginning we should accept the fact that time to time we may have to modify according to the timely needs.
Excellent, thank you. Some really excellent points in here about what, as you shared, sort of that, Phil, as you said, that template and what that template then enables both at the local and regional levels. And I think that's a really important point, both at how do we explore this at the global level, but how do we also build, as you said, Dr. Saif, from the ground up, right, and engage folks in the design and implementation of that. I think that's such an important point. I think I've got my last round. I'm just checking if we'll have time for Q&A from the audience. How are we on timing? Okay, so we are going to do our last round of questions. I think we're going to do a panel picture, and then I'm going to introduce our closing keynote remarks. But my colleagues, what we'll do in this sort of lightning round, if you will, is very quickly, We're here on the sidelines of the World Health Assembly at this side event, and it's hard not to talk about the role of WHO in this conversation, given where we are. And so to close us out very quickly, let's aim for a minute, but we'll see, I will not time you. What role do you think WHO and other partners should play in supporting governments in the development of a data governance framework? So we'll begin with you.
Sure, I think, as I mentioned in the earlier comment also, IHR, International Health Regulations, I think we can closely move with that, and though it is a different need, I think that is the available, most closest type of mechanism. I think we can, the WHO also definitely have a role in that manner.
Absolutely.
Yes, of course, we know that WHO and other partners can provide technical assistance and funding support, but I think more specifically, I think that they could actually make country experiences more easily available for governments of what did and did not work. And quite frankly, I think there's a lot of improvement that I think that could be made in terms of streamlining the information. So I know the eagerness of everyone to actually provide this kind of information. And then secondly, I think playing a third-party lens and ensuring that there is actual policy coherence within the framework that is developed. And that's very important. And I think I would like to extend that really the support should not be limited to framework development. I think we've also heard reference to making sure that action's already being taken and that we operationalize these things. So I think that the support should extend to supporting institutional capacity development and more broadly for sectors, and hopefully, maybe this is too much of an ask, but even including capacity development of other sectors. I think distinctly for health and for the Ministry of Health in the Philippines, a lot of our ongoing work involves multi-sectoral action. So we're anticipating that. And likewise, also providing support when it comes to policy innovations.
Excellent.
Thank you. I think one is the technical support, but secondly, I think, how do I say it, but we are talking data. So data, for example, if I have my mobile phone here, and as he said, I want to access my information, I need to have the data. But now you cannot easily access the data. You need to have money. So it's now to see how they can help to make, because data is business. And now we are going to making that information being accessible to people. So how WHO and other partners that can help, I think, is to lower the price of the data, especially in the developing countries, so people, they can use how they do it. That will be the most important to me. I was coming here in this room, I just want to have internet, but I'm not able to access it. So, yes. So that's one of the points to just say. But if I come here, I wanted to call, the roaming charges is very expensive. So if you are sick and you want to access your information, how do you do it? Thank you.
Thank you.
Yeah, I think WHO is in a strategic position to align the understanding between nation on best practices of health data governance. Also, WHO can assist countries to put, for example, the health data governance into the regulation and bring some best practices to others country rather than they build a new one and then use this for the best example to others countries. Thank you.
Three things. WHO, as a a body of the United Nations that has the convening capacity for all of us to come. Even on this panel, we've got different perspectives. I think continuing to play that role of bringing us together to align on what is the right thing to do collectively. And then, of course, individually, countries will go and continue to do what they have to do domestically. I think that's important. The second thing, a lot of innovation is needed, and innovation needs capacity. I think WHO has this very unique role to lead in innovation, thinking through the possibilities in the future. But lastly, because I didn't get a chance to talk about the risks, on my first question. You know, everyone talks about data being the new gold. And when there is something that is precious as gold, you know, the thieves are not far. The illegal miners are not far. Who's going to find them? Who's going to catch them? So there is also a role to help protect that value from being misused. And I think that's a role that one single country cannot play, because guess what? The thief doesn't need to be in your country. He may be located in a jurisdiction that you have no access to. So we need a global mechanism for protecting the value of health data. And I think, you know, WHO has a unique role in that.
Absolutely.
Thank you.
Well, I think that is the remarks that we should end on. I don't think I could summarize it better myself. So please join me in a round of applause for our panelists. Thank you all so much. Before we move on, thank you all so much again for joining us. I am delighted to invite to the stage Stephen McFeely. He is the Director of Data and Analytics at the WHO, and he will give our closing keynote remarks. So thank you. Please join me in a round of applause. Thank you.
Thank you, and good evening. Honourable Ministers, Excellencies, ladies and gentlemen, colleagues. It's my great pleasure to make these closing remarks. There isn't really much to say at this stage that hasn't been said, and I'm conscious that I'm probably standing between you and your dinner, so I'll be brief. First of all, I want to thank Transform Health both for hosting this event, but also pushing this really, really critical agenda. Transform Health and WHO, and I think many people in the room, we all have one thing in common. And we have many things in common, but there's one thing I really want to highlight this evening, and that's that we all want to achieve universal health coverage. And in this discussion, maybe we've lost sight of that. So given the increasing focus of digital solutions to advance that agenda, it's really critical that we first put in place robust data governance. And let's be honest, we cannot seriously talk about patient-centered data. We cannot seriously talk about empowering individuals to use their own data unless we have data governance in place first. It's a ludicrous conversation without those. We heard this evening, we're all striving, both in the WHO and in member states, we're all striving to overcome fragmented data systems. We all share the aspirations for interoperability. We all dream of complete CRVS systems. The Minister of Zanzibar talked about the need to integrate data. The colleague from Tanzania highlighted the importance of organizing our data. And indeed, we've seen the great strides that have been made in Sri Lanka and Maldives in recent years on these fronts. But in doing so, in linking data, in sharing data, in moving data, we introduce risks. The Ministry of Indonesia and our colleague from CDC highlighted and emphasized these points. So we must ensure that we do not support data colonialism. We must ensure that whatever we do not support breaches in human rights and in data privacy. In recent days, the G7 have published a communique in which they recognize the fundamental importance of data governance to achieving universal health coverage. The call for a global health data governance framework is critical, but as we've heard from the Philippines, health data, the health sector does not exist in a bubble. The determinants of health, the outcomes of health often exist and manifest themselves in other sectors. So while we think about the importance of health data governance, it's really, really important that we also think about the calls from the UN for a wider global data governance framework. That data governance framework is not competing with what we're proposing here. In fact, quite the opposite, it's symbiotic, that one really will support the other. So before I close, I would just like to echo the words from our colleague from Cameroon, that we really need to come together around a common vision. And as our Philippines colleague noted, that needs to include both the public sector and the private sector. My sincere congratulations this evening to Cameroon, to Costa Rica, to Tanzania, and to Zanzibar for showing leadership and having the vision this evening to stand up and take a lead in this really critical issue. We live in a data age, and this really is one of the issues that faces us. In closing, Matilda asked a question earlier. How do we drive this agenda forward? So now I'm really speaking to the ministers here, to the member states. Between now and September, you will be negotiating on the Universal Health Coverage Declaration. You'll be negotiating the SDG Summit Declaration, and you'll be also discussing the Global Digital Compact Declaration. These are all huge opportunities to place the importance of data, health data, and data governance front and center on the global agenda. So should member states call on the WHO to develop, in partnership with you, a global health data governance framework, we stand ready and enthusiastic. Thank you.
Thank you so much, Stephen, for those great remarks, closing remarks. And so to close off this session, I would like to thank our Ministers of Health of Cameroon, India, the Maldives, Philippines, and Sri Lanka for co-hosting this session with us here today and recognizing the importance of this issue. I would also like to thank our partners, AHIN, Rekinsa, Helena, and all of our coalition partners who really made this event today a reality. I would like to thank all of our distinguished speakers and welcome their commitment to continue to work together to strengthen the governance of health data and develop a global framework. There's clearly great momentum on this important issue, and we must now ensure that this translates into concrete action, as Stephen has said, and we rely on all of you to get us there. So thank you everyone for joining us today, and I also would like to just let you know that we have a drinks reception in the Thermal room, which is just around the corner. If you walk out to the right and past one room, there is a drink reception there, and we hope to see you all there and continue the conversation. Thank you.